Hi, I'm Dr. Braha. I'm a board-certified gastroenterologist here in Brooklyn, New York. Today, we're here from ZerMed to talk about colonoscopy and colorectal cancer screening. Early detection is the key to colon cancer. By finding cancers early, we can often cure them, especially with colon cancer, where we can prevent colon cancer by removing polyps. These are small growths that we can find during a colonoscopy in the colon. By removing them, we can prevent the development of colon cancer. So today we're here, instead of in the studio, at Brooklyn Gastroenterology and Endoscopy Associates, here in the Sheepshead Bay section of Brooklyn on Emmons Avenue. We're here today in the surgical center where we have patients who have come for screening and surveillance colonoscopies. If you're watching today and you're 45 years old or older, you are eligible for a screening colonoscopy. This is where we take a small camera while you're sleeping, place it into the rectum, and go through the entire colon looking for colon polyps. We don't feel colon polyps, and oftentimes we don't even feel or know that we may have a colon cancer. So early detection and prevention is the key to preventing colon cancer and curing colon cancer. You will see today colonoscopies where we go looking through the colon and find such conditions such as hemorrhoids or diverticulosis and colon polyps. We find these in 30 to 40% of patients and can remove them during a colonoscopy. As I said, the procedure is painless and takes about 15 minutes. So if you're over the age of 45, if you have a family history of colon cancer, if you have any symptoms that might be associated with colon cancer or other significant colon diseases, such as Crohn's disease or colitis, we want you to go see your provider, your primary care physician, your doctor, and ask them if you're eligible for a colonoscopy. Some alarm features that we want to look out for that would prompt us to do a colonoscopy at any age would include bleeding, red blood in the stool, red blood noted in the bowl or when you wipe, black or dark stool, diarrhea that doesn't go away after maybe a week or two, and also weight loss or abdominal pain that goes unexplained. If you have any of these, please go and see your primary care physician to determine whether or not you are eligible for a colonoscopy. But anyone watching today over the age of 45 should be screened for colon cancer. So thank you for watching, and I hope you will learn from our procedures today where we go and perform colonoscopies on our patients, searching for colon polyps and for colon cancer. So thank you for watching. I hope you've learned a bit about colon polyps, colon cancer, and colonoscopy. Now let's get up and go into the surgical center where we're going to start performing colonoscopies today on our patients. And I hope you enjoy the show and that you're able to learn from our program here at ZerMed. Thank you for watching. Let's go. Hi, I'm Dr. Braha and welcome to ZerMed. Today we are doing colonoscopies on patients who are here for screening. These are patients that have no symptoms of colon cancer. They have no symptoms of a colon polyp. They are healthy patients. And as the guidelines and the gastrointestinal and cancer societies recommend, we should be starting colonoscopy for screening at age 45, meaning that anybody over the age of 45 is eligible to undergo colon cancer screening. And one of the tier 1 tests that we do, and the only test where we can screen for cancer, we can screen for polyps and remove polyps at the same time, is a colonoscopy. We take a small camera with a light at the end, and we make our way through the colon during this painless procedure. Patients are sleeping with sedation through the intravenous line. They do not feel anything. And depending on the case, on average, it takes about 15 minutes to complete the procedure. The day before the procedure, patients take a bowel preparation where they clean out their intestines. This is a medication that is taken with either pills or a liquid solution. And on the night before, patients will go to the bathroom a few times with watery stool that cleans out the intestines and allows us to look inside the colon with this flexible tube. During the procedure, if we see any polyps, we can remove them. Many polyps cause colon cancer. Over the years, these polyps grow, and almost always we will not feel them. We will not have any symptoms from these polyps. They silently grow in our colons, and over the course of many years, they turn into colon cancer. And the only way to prevent colon cancer is to remove these colon polyps. The procedure is safe. There's a rare risk of an injury to the colon, bleeding or infection, but the benefits of the colonoscopy greatly outweigh any risks. We know that 5% of the country gets colon cancer. And in our practice, 30 to 40% of the patients that we screen for colon cancer with a colonoscopy have a polyp. And so when you think about it, you're sitting in your first grade classroom with 20 people. One person in that classroom, 1 out of 20 people in this country, get colon cancer. And so we have to prevent colon cancer. And by seeing your physician, your gastroenterologist, we can best recommend which test is right for you. But colonoscopy is the only exam where you can detect small polyps and remove them at the same time. So here we are in the colon. We have reached the beginning of the colon. The way that we know we have reached the beginning portion of the colon is we see something called the appendiceal orifice, which is the opening to the appendix over here, this small circular structure. This is the beginning of the colon called the cecum. At the top portion here, there is a valve where the small bowel empties into the large bowel. The large bowel is our colon. As we're doing colonoscopy, we slowly remove the camera and we inspect the walls of the colon in search of polyps. We look all around, 360 degrees, searching the colon for polyps. Polyps range in size from teeny tiny little polyps about 1 millimeter in size to larger polyps. And most of the time patients have no idea that they have a polyp. They cannot feel it. They don't see any symptoms. Some symptoms that would make us quite concerned, that would prompt us to do a colonoscopy at any age, include bleeding, seeing red blood in the stool or in the bowl, black colored stool, which could indicate bleeding, patients who have weight loss, patients who have diarrhea that we cannot explain otherwise, such as an infection, patients with family histories of colon cancer or a family history of advanced polyps. We may decide to do their colonoscopy earlier than the age of 45. So here we are making our way through the colon. We've reached the midpoint of the colon called the transverse colon. The colon measures somewhere around 5 or 6 feet, depending on the patient, but it's like an accordion. It expands and contracts. During a colonoscopy, we use air to open up the pipe, and the air opens up the colon so we can detect any polyps that might be growing on the wall of the colon. The fluid you see here, the yellow or green fluid, is normal. This is normal intestinal liquid. It's a combination of fluids like bile, gastric secretions, and we just suction this fluid out during the procedure to get a better look at the walls of the colon. And so here we are moving our way now into the descending colon. This comes down the left side of our bodies. As the stool, as our poop moves through the colon, it gets more solid. When our contents enter the colon from the small bowel, it's more liquidy. And as we move our way through the colon removes water from our stool so that we don't have diarrhea. And the stool becomes more solid as we come through the colon here. During the procedure, we have a few people in the room. Our staff includes nurses, technicians, anesthesiologists, and of course the physician performing the procedure. So when you come for your colonoscopy, you'll meet a whole team of people taking care of you. During the procedure, everybody is focused on the screen, looking for polyps. And here we are making our way into the sigmoid colon, which is closer down in the left pelvis, closer to the exit, the end of the colon. And you can see the patient is quite comfortable sleeping. They don't feel any of this. I've had a colonoscopy in the past. I can tell you that the sedation is wonderful. You get a beautiful sleep. And here we are moving a bit further down into the colon. We're going to enter the very end of the colon, which is called the rectum. The rectum is where the stool starts to accumulate. We feel when the rectum starts to get full. That's the signal to us that we need to go use the bathroom and pass stool. That is sensed down in the rectum. The rectum is also where we have veins called hemorrhoids. Now, the veins in our rectum are normal, but some people will suffer bleeding, pain, itching, and certainly patients who have these symptoms should see their physicians to determine if they need a colonoscopy or if there's any treatment that we could provide. This here, this little teeny red spot, is where we removed a polyp during the colonoscopy, a very small polyp. And this is a view of the rectum. This is a normal appearing rectum here. So we complete the colonoscopy, we remove whatever air that we put in, we suction down the air so the patient wakes up comfortable. And in a case like this where we found one small polyp that we removed here, the patient will come see us again in 5 years. And that concludes the colonoscopy.